This video is all about marijuana. We're going to talk about how this substance affects both the brain and the body, the short-term and long-term implications for our health and happiness. And now, importantly, this is not going to be like, oh, everyone should smoke weed. But at the same time, it's not going to be like, this substance is the worst thing ever or something. I'm trying to avoid some of these more like ethical right or wrong judgments and really just do my best to step back, done some research on this topic, and give sort of a objective yet scientifically grounded assessment of the short-term and long-term implications of using marijuana. And now this is especially important because this becomes such a popular thing. I mean, I think it's always been pretty well used, but certainly in the last 5 to 10 years, with so many states moving towards medicalization or legalization, you see a kind of an increasing instance of use. In fact, it's the number 4 most commonly used drug in the entire world. And so we talk about drug as, let's say anything that has a psychoactive effect that's changing our state of being. Number 1 is caffeine. Okay, probably about 3 to 4 billion regular users. You have number 2, alcohol. Again, probably a couple billion regular users. Number 3 is nicotine, and then number 4 is marijuana. So again, as it's becoming very popular, I think we need to have a kind of research-grounded understanding of how this affects us, again, short and long term, and that's what we get in this video. So let's get started. First thinking about a little bit of the maybe biology or the mechanisms behind how this works. Marijuana contains numerous components that affect our mind and body. And the most commonly known ones, you have THC. Now, this is the part that's kind of responsible for the psychoactive component, the more like the high, but the high that you get sort of in your mind, right, in your kind of cognitive experience. Whereas CBD, which in many states is legalized, doesn't really have the cognitive components as much as kind of the physical effects of maybe feeling some relaxation or reduced pain. So now the kind of high, right, the effects that come from these chemicals are driven by something called the cannabinoid receptors. So all human beings have in our cells, in our brains and our bodies, these receptors. And these things are kind of like little holes or little parking spots, you can imagine, where certain chemicals fit into those parking spots. And then those drive changes in the cells or in the brain or in the body. Now, importantly, they're called cannabinoid receptors. That is because they are named after cannabis, right? It's not like, this is an important detail. It's not like we somehow were evolved to interact with cannabis or marijuana, right? It's more like scientists realized that cannabis acts on these cannabinoid receptors, and so they said, we're going to call them cannabinoid receptors. It doesn't mean that they literally were meant to be used for cannabis, right? They existed on their own in the human physiology for thousands of years before we started smoking or using cannabis. So that's an important caveat. So we have these receptors, and they're named for that because, again, they interact with cannabis, but that's because we have these cannabinoids that are produced both internally, like just naturally our body produces them, and then of course externally or exogenously if you smoke or ingest cannabis. So when THC, CBD, right, these cannabinoids interact with those cannabinoid receptors, they produce a number of changes in mood, hormones, physiology, state of mind. And so it may be worth, again, to just understand some of the biochemistry here. Think of it in terms of testosterone, right? For instance, that's a hormone circulating in the blood. You can make it naturally internally, or you can take steroids, or you can take testosterone placement therapy. You can get it externally. In either case, this chemical is floating around the bloodstream, and your cells have testosterone receptors, known as androgen receptors. And when they have some testosterone that kind of binds to those receptors, you get changes in the cells. So maybe it's, more hair growth or something, right? Testosterone. So same way, we have these internal cannabinoids that do a bunch of things. They're actually fairly complex. We don't know all of what they do, but they affect cognition, mood, physiology. But the important thing here is that when we take in these external cannabinoids, they essentially outcompete our natural cannabinoids. So again, let's use this analogy of testosterone and taking steroids, okay? So testosterone is naturally circulating through the body. When it binds to the testosterone receptors, there are certain changes that come about physically and maybe even moment to moment in your kind of mood or how you're feeling. At the same time, similarly, if you were to take steroids or some external testosterone that elevates your testosterone to a very high level, you're going to have effects that are beyond what you would normally naturally experience. Now move that metaphor over to marijuana and cannabis and cannabinoids. You have these naturally occurring cannabinoids in your body that have these variety of effects, but when you externally take like kind of a bigger dose of them, it essentially outcompetes your natural cannabinoid system. And that's why these highs are so pronounced in terms of our like normal cognition, right? When we smoke weed or ingest marijuana, right? It's very pronounced changes in your state of being. And that's because these external cannabinoids acting on those receptors stimulate them much more intensely with a much higher level of potency. Okay, so that's kind of what's going on at a biology level here. I won't go too much deeper into it, but it's important to note that, and we'll come back to this later, that is part of the danger of long-term cannabis use, or a downside, is that your receptors kind of get used to, so to speak, needing a higher dosage or a higher potency of cannabinoids to feel satisfied. Okay, not very scientific there. But so they're sort of conditioned to expect more and more and more. And that can lead to issues then when we're just at baseline, feeling increased anxiety, increased kind of dissatisfaction or depression, etc., because it just feels like, oh, I need more. Imagine if you were to have 2 cups of coffee every morning, right? And then all of a sudden you stop. Well, when you just get up on that morning with no coffee, your kind of baseline is lower because you need more of that external stimulation. So that's a danger of how this happens. But again, I just wanted to give an idea of how this works, what's going on kind of biologically and mechanically when we interact with marijuana. So let's consider just briefly now the short-term effects and then the long-term effects. So if you smoke, eat, you can actually also ingest marijuana orally through the mucous membrane with something called a tincture, or intravenously, which I think with directly into the bloodstream certainly would be the least common and probably the least advisable way to do it. But you're going to get a peak in the effects about 30 to 60 minutes after consumption, usually going to last about 4 hours, depending on your metabolism, your tolerance, the method of consumption, etc. You have 3 main varieties of marijuana. Cannabis sativa, that produces more of typically a stimulating sensation, a little bit biased towards like the head, kind of a head high, whereas cannabis indica is more sedative, relaxing, and kind of embodied, kind of a body high. This is speaking from the literature. That being said, now this is something I thought was interesting that I learned recently, that there's no real way to predict individual effects. Okay, so if just one given person smokes, as a whole, we know that sativa is a little bit more alert, energetic, upbeat, and we know indica is a bit more relaxed and chill, but what you individually can kind of expect in terms of your subjective experience of a high is very hard to predict. In fact, I would use the analogy of like an insurance provider. So stay with me here. You're like, car insurance and marijuana, what is it? Car insurance, for instance, they know, because they have a data set of millions of people, they know they can say, okay, for men aged 18 to 25, we know that 8% of drivers will get in an accident this year within that category, okay? So they know that because they have so many data sets and they've been doing this for years. They know it's going to be 8% of that million people. But if you were to pick out one specific driver, Tom Smith, it's pretty much impossible for them to predict how likely it is for him as an individual to get in an accident. Okay, so any one individual, we don't really know how likely it is that they will get in a car accident, or that they will win the lottery, or they will die of heart disease. But when we look at millions of people, it's kind of easy to say this percentage or this probability. So we know that, bringing this back to marijuana, at the high level, right, these are the effects to expect, but at an individual level, it's very hard to predict, even when you look at things like your disposition, your tendencies, or your biology. So don't know exactly what's going to be in store for you in the short term when you do this, so you kind of have to experiment or, not do it, not experiment, but that's up to you. A couple other short-term effects that I thought were interesting. Marijuana does impact sex drive and arousal, but just like I said just now, it affects different people in different ways. It can actually amplify or suppress sexual desire and arousal. It kind of just depends on your makeup. There's no real way to predict it. Similarly, another area of divergent effects are in the cortisol system, which plays a large part in regulating both stress and anxiety. This explains why some people can smoke the same, or smoke or ingest, however you do it, the same like quantity and type as their friend, but one of them can be super like relaxed and chill and good mood, and the other might feel very anxious and paranoid because it's working on your cortisol system, which helps to regulate stress and the part of your brain that kind of responds to stressful stimuli. And so for some people, it seems to be more like, oh yeah, no stress, this is awesome, let's go. And some it's like, freaking out, okay? Final short-term effect. This one is kind of more common to just about everyone. Marijuana reduces electrical activity in the hippocampus, which is an area of the brain responsible for processing memory, and so it will lead to deficits in short-term memory. Now, don't get me wrong, this does not imply that if you were to consume marijuana one time, your short-term memory is going to be thrown off forever, but like in that moment, there's going to be deficits in memory. So let's turn to some of the long-term effects. So, far from, let's say, consensus science here, we're starting to see some trends in the literature that suggest that while there may be some use cases for the substance medically or even recreationally, that there are some serious long-term consequences we need to consider when it comes to our health and happiness. So starting with potential positive use cases, there are some studies that look at this like for pain management or for stress and anxiety, even sleep, especially people who are dealing with like chronic illnesses or cancer, etc. And it seems that there may be some promise there. Similarly, most studies, I would argue, if you're looking at people who are above the age of 25 and you're occasionally recreationally using this substance in responsible ways, you're not driving, doing other things, whatever, and we're going to say roughly less than one time per week. Probably minimal, depends a lot on the person, minimal long-term negative side effects. And so if it makes you feel happy and upbeat and it's something to celebrate, maybe that's something to consider. Again, I'm not going to steer you one way or the other. But what we should consider is chronic use. Okay, so chronic in the literature is roughly summarized as 2 or more times per week. Again, not very precise because 2 or more times per week is that, I take one puff or I eat one little gummy edible twice per week, or is it like I'm getting super high? It's hard to, in studies where you can't bring people into a lab and have them live in the laboratory and smoke weed once a day for a year, right? No one would do that study. You're kind of painting with a broad brush here, but we're going to say roughly twice a week or more would be chronic use. So let's talk about some of what we found for that. Chronic use leads to increases in a chemical called prolactin, which diminishes your overall drive and particularly your sex drive. And so testosterone levels are lower, as well as actually sperm and egg quality. Okay, so not just a guy thing here with testosterone, egg quality as well. Now, again, I touched on there's some literature linking this to using marijuana to improved mood or some reduced anxiety, maybe pain relief. Again, chronic use has some pretty negative implications, it seems, for your long-term health and happiness. So as we recall about whatever that was, 3 or 4 minutes ago, I discussed how biologically this stuff works. And we said that you have cannabinoids, which it's not like weed, marijuana is naturally occurring in you. That's just what they're called, again, right? Naturally occurring in your body that interact with these cannabinoid receptors. But when you bring in these external ones, they're way more potent, way more powerful, and they kind of condition your cannabinoid receptors to need more and more. I use that analogy of drinking 2 cups of coffee per day, and then you quit coffee. So what we see is that it's pretty easy to build up a dependency issue with marijuana that ultimately affects our baseline mood and satisfaction when we're not using it. In fact, excuse me, I had to review my notes. Chronic use has been shown to actually raise anxiety over time. So again, like that little coffee analogy, you have the substance, you're maybe feeling less anxious, more relaxed and chill and a nice high. But again, you're conditioning those receptors so that when you don't have your 2 cups of coffee, quote unquote, metaphor for marijuana in this case, your baseline level of anxiety is going to increase over time. In fact, chronic users are 4 times more likely to suffer from depression and anxiety. And really where this gets bad is looking at chronic use under the age of 25. And that's because the brain is still developing until, we're going to say, depends on the person, depends on the context, roughly 21 to 25. And for those of you watching in the US, that is why, despite 18 being the age where you can become an adult and you can go off to war and you can vote for the president, you may say, well, why can't I buy alcohol? Well, it's because until you're about 21 to 25 range, the brain is technically still developing. And what we see are a variety of very adverse mental health consequences for chronic use under the age of roughly 25. Increased risk for depression, increased risk for psychosis and related mental disorders, and increased risk for schizophrenia. Okay, so certainly, while earlier I said, look, if you are potentially an adult over the age of 25, occasional recreational use may be fine. If you are under 25, and especially if we start to talk here about more frequent use, this has absolutely been shown to be detrimental to our long-term health and happiness. Final note here that I thought was interesting is that developing babies, okay, the fetus, right? We have a pregnant woman, a nursing woman. The fetus actually has a very, very high density of cannabinoid receptors that seem to play a key role in neurological development, right? The development of the brain and nervous system. So we still don't know exactly what the implication is for pregnant mothers using cannabis, and it would be quite hard to, because you couldn't really ethically do an experiment on that. But the implications could be massively dangerous. And the reason for that is, like I said, when you think about the density of these cannabinoid receptors in the fetus, the developing baby, very, very high density, and they seem to be kind of a critical factor in governing brain development in that developing baby into child. So important note is that pregnant women, nursing women, please avoid cannabis use. So let's summarize what we talk about here. Okay, we did a little bit of the maybe nerdy biology, probably wasn't perfectly explained. I'm doing my best to learn a bit more about neuroscience as I go here. But, we talked about how this works, right? You're ingesting these cannabinoids, acting on your cannabinoid receptors, producing this high, and over the long term, potentially some negative consequences because you're conditioning those receptors that it's going to affect your baseline states of being. And we talked about how chronic users, more than 2 times a week, seems to be pretty detrimental for your overall health and happiness because it's going to increase your anxiety over time and it increases your risk for depression and other mental disorders. Importantly, we talked about, for particularly if you're thinking of a developing baby, but really the developing brain up until that age of 21 to 25 is probably best to avoid marijuana in pretty much all forms. And finally, we talked about in the short term how it's quite variable, how the substance will affect you. It may be kind of an elevated, excited, positive mood. It may be a more chill and relaxed and sedated mood. Or it may be rather unpleasant. It may be kind of paranoid or stressed or not into it. And so ultimately that is something that is quite hard to predict. So the final summary, how does marijuana affect your health and happiness? Based on the stuff I've studied, What I would say is if you're over the age of like 21 to 25 and you're occasionally using this, so less than, let's say, 1 time per week, and you maybe enjoy it or you feel that it improves your mood or it's a fun thing to do, and I'm not going to tell you you should or shouldn't do that, but there's likely minimal risks for your long-term effects on the brain and body. If you are younger, developing, or you're thinking about using a 2, 3, 4, and beyond times per week, that chronic use category is probably not an optimal lifestyle. So as always on this channel, I do my best to share both some of the art and the science of happiness. This one, of course, being pretty squarely in the category of science. I'll include some references down below, but all of this is designed to help to educate you, share what I've learned in my own studies, to help you live a happier life. So here's a video that YouTube suggests you'll like, and that's all for now. I'll see you next time. This has been the Happiness PhD with Jackson Kirchis.